The views and opinions expressed in The Fact Is with Hollis Grant are those of Hollis Grant and do not necessarily reflect the official policy or position of Droids Canada Network. Droids Canada Network does not take responsibility for any content or position produced by Hollis Grant and his show. Listener discretion is advised.
Good morning, good afternoon, and good evening. Thank you for tuning in to another edition of The Fact Is. I'm your host, Hollis Grant, and today we're going to be talking about illegal drugs. Taking you to the city of Toronto in Canada for this particular story. Now, let me paint a picture for you. You are a young couple or an older couple. You save, you decide to move. You decide to move into the city, or you're taking your first steps into the housing market. You find that the average house price in Toronto is $1.1 million. That's for the average home. The average salary in Ontario was only $67,000. But nonetheless, you have enough to buy this home, and it's not a large home, so we'll say $800,000. And you decide to buy this $800,000 home, and you decide to start a family. Because in Canada, it is illegal to do certain drugs or have possession of certain drugs. But then, all of a sudden, the bureaucrats decide, let's change the rules without asking the public their input, without asking them if this is something they would want to see in their city. Now, you have to keep in mind that drug possession is a federal issue and not a provincial issue. These are criminal code violations, and the criminal code is owned by the federal government. So even the provincial government, or you'd say a state government, can't make those laws or change those laws. So we're talking federal crimes. So Dr. Eileen de Villa, and we've talked about Dr. Eileen de Villa on the show before, droidscanada.com, for our prior episodes. You can take a look at some of those. And the infinite wisdom of what is Toronto Health in the city of about 4 million people, and the health board decide that they will petition the government to allow illegal drugs. And the headline reads from CBC, Toronto Board of Health votes to decriminalize possession of small amounts of illegal drugs. Now, we have talked about CBC before. We've talked about their slanted views, their left-wing approach, how they are controlled and run by unions. So we are going to read this particular article because we want to highlight how this is a good idea. So the board authorizes city's chief medical officer to request exemption from Health Canada. The Toronto Board of Health has voted to ask the federal government to decriminalize the possession of small amounts of illegal drugs in the city to help tackle the worsening opioid overdose crisis. During a Zoom presentation Monday to the board, Dr. Eileen de Villa, the city's chief medical officer, said decriminalizing drug use is crucial to help people who are struggling with addiction. Decriminalization will reduce the harms associated with drug use and help to remove barriers that people who use drugs tell us they experience when accessing health and human services, she said. Toronto saw 531 opioid overdose deaths last year, which is an 81% increase over 2019. De Villa said decriminalization would help save lives by addressing the, quote, stigma and the discrimination that keeps people from seeking help. Municipalities cannot unilaterally decriminalize drug use, as it's the sole responsibility of the federal government. But Monday's vote authorized De Villa to seek an exception for the City of Toronto from Health Canada. So essentially setting up a sanctuary city. A sanctuary city such as San Francisco, such as Portland, such as Seattle, in New York, all of which have increased crime and increased drug use after becoming a sanctuary city. But back to the article. De Villa, who recommended decriminalization to the city last week, told the board some groups are more prone to being targeted by the criminal justice system than others. Criminalizing drug possession has disproportionate effects on indigenous and black populations who are more often over-criminalized for the prosecution of simple drug offenses, she said. Criminalization of drugs has not been effective in reducing either the supply or the demand for drugs, and moreover, the unregulated drug supply is becoming more toxic and unpredictable, causing overdoses and other harms. De Villa said the goal is not legalizing illicit drugs, but ensuring people who possess small amounts of illegal substances are not under threat of being arrested and criminally charged, which increases the likelihood they'll use street drugs alone and in unsupervised settings, raising the risk of overdoses. She said the coming of the novel coronavirus only worsened the situation. There is already a serious drug poisoning crisis in Toronto before the COVID-19 pandemic, and this crisis frankly has only been worsened and exacerbated by the COVID-19 pandemic. In a statement to CBC Toronto, the Office of the Minister of Mental Health and Addictions, Carolyn Bennett, said it recognizes the different approaches cities, province, and other organizations are taking, and it is supportive of their work to find innovative solutions when it comes to saving lives and reducing harm. Bennett's office is reviewing requests for an exception from federal drug laws to decriminalize personal possessions of controlled substances from the City of Vancouver and the province of British Columbia. Her office notes it will review any request for exemption it receives. During Monday's board meeting, many members of public and advocacy organizations came forward to push for decriminalization, including Alejandro Gonzalez Randon with ACORN, a group that advocates for low-income people. As someone who lives in a Toronto community housing building, he sees how the policing of people who use drugs has resulted in mass displacement from these communities, adding more trauma as a result of dislocation from family separation, he said. To decriminalize simple possession of drugs is only one step in the right direction, he said. It's also equally important to address the social detriments of mental health. Angie Hamilton, with Families for Addiction Recovery, said decriminalization of drug possessions needs to go further than just a city-by-city, municipality-by-municipality, or even province-by-province basis. Our criminal laws fall under federal jurisdiction. When someone is convicted of committing a crime, they're labeled as criminals. The same activity shouldn't be criminal or not criminal depending on where you live in Canada, she said. In an interview with CBC, Dr. Leslie Buckley, chief of the Addictions Division at Toronto Centre for Addiction of Mental Health, said the centre has long called for drug use to be a public health issue, not a concern for the legal system. She said by reducing the stigma, people who use drugs are more likely to seek treatment early. Criminalization of substances has not been effective, and it creates social harms, she said. We're shifting more into a health lens and getting people the care they need. So, taking a look at this particular article, they're already making the argument that it shouldn't be by a city, it should be everywhere. Now, it's interesting because this was not put to a vote. These people did not ask the public of how they felt, because we can go back and we can see how the city has degraded. And the reason where that it started degrading is when the same argument was used for safe injection sites. And when the exact same people that advocated for safe injection sites said it's to help people. We need to get them into the system so we can work with them and they can take the stigma out and treat them like individuals and get them the help that they need. If that's the case, then why is it that outside of every safe injection site there are plethoras of needles, to the point that each city has a dedicated team that will go around and pick up dirty needles? From their own website at the City of Toronto, there are numbers to call if you find a needle, and they will send out a hazmat team to go pick them up. There are countless articles relating to children going in to a playground and getting hit with a needle, a dirty needle, and now having to go and be tested for AIDS and hepatitis C. That particular case was taken from September 5th, 2019, when a 5-year-old had to undergo HIV and Hep B prevention after being pricked by discarded needles near the schoolyard. And that's just one. There are countless articles about how dirty these sites are, how dirty the streets of San Francisco are, how dirty the streets of New York have become. But notice that let's decriminalize. It's okay for the drug user, the one that's not dealing. It's okay. We can help them. Well, I'd like to understand the point of how it is helping them. These drugs are beyond anything that humankind has seen in the last 50 years. There is nothing to compare to. When you're talking a drug is so addictive that you're willing to sell your body for pennies, for a mere scrap of a drug. When drugs are so powerful that your teeth will fall out, you have open wounds on your face, and the only thing you can think about is getting your next fix, you will steal at all cost, at any cost, just to get your next drug hit. These people will say anything to get their next fix. So if they go into the system and they're smoking up methamphetamines, injecting whatever into their body, all they're concerned about is getting high. And once they're high, all they care about is being high. And they'll say anything to anyone to get the next fix. So how about a new approach and not just say decriminalize? How about decriminalize if you were involved in the successful prosecution of your dealer? If you're putting the dealers away and start to work up the chain, because these drugs aren't coming in or being manufactured in Canada or in the United States. They're being imported, and they're being imported from Mexico, and they're being imported from China, and they're being imported from other parts of the world. Yes, there's some are made here, but when you're talking about the sheer amount, this is an international problem, and those countries need to be held responsible for the intentional killing of citizens. So it's time to turn up the heat. Time to squeeze out Mexico or to squeeze out China. But with weak leadership, it will never happen. Now, how would you feel of buying $1 million home in a city where now they're advocating to say, yep, let's just open this up? Because there's going to be one outcome. You're going to have drug addicts from all across the region moving in and descending in on the streets of Toronto, because they know if they get caught, one, they don't have to go to jail or spend a few nights away in jail, but they can just keep on going back and stealing and doing more break-ins and more peddling and more prostitution to get their next fix. But yet these doctors or these bureaucrats that make $309,000. $309,000 is what Dr. Eileen de Villa has taken from taxpayers. Now, what's really interesting when we look at how much she has made is what she was making in 2017. In 2017, she was only making $215,000. $215,000, and again, we pointed out that the average Ontario wage is, and I'll correct myself, $52,000. It's $52,000 is the average, and that was as of September of 2017. So the average wage in Ontario is $52,000 in 2017. But Dr. Eileen de Villa made $215,000, and then in 2018 made $301,000, and then in 2019 made $309,000. And she, in her infinite wisdom, wants to put and make illegal drugs legal in the city. Now, we tried to do some research, only to find out, where does Dr. Eileen de Villa actually live? Does she live in the city proper? Unfortunately, I don't have that information. It's something that we don't have, and nor would we ever give an address out. But it would be interesting to know in which city and what area does Dr. Eileen de Villa live. Because these policy makers that want to change the city and want to help out never seem to live in the areas that are most affected. The most affected happen to be the poorest neighborhoods. And these are the people that are already dealing with crime and already dealing, and now you're adding more. But the worst part of this entire situation is that this was never asked by any of the citizens. The people that it will affect the most have zero say on how their city will be run. There is an erosion of democracy. There is an erosion of public trust in elected officials. And this is happening at such an alarming pace of city over city and country over country, that where will it end up in the next year? I'd like to thank you for tuning in to The Fact Is. I'm your host, Hollis Grant. You have yourself a great week.
Dan, what happens every Thursday?
That would be DCR Droids Canada Radio.
And what time is it at on Thursday?
That's from 9 till 11 p.m.
Dumb question, where do you find it?
You find that at accessradio.ca.
And what's the best part?
It's